Hey everybody, I would like to welcome you back to Living Proof Chiropractic. I'm Dr. Jamie Ferrante. What we're going to end up talking about today, I'm going to go into a little bit of a deeper dive about why we're actually starting this channel just in general. Obviously, it's here so this way we can end up giving everybody out there some information about what chiropractic can end up doing for you and how certain things involved with my profession can end up helping people get to the place that they want to be in a healthcare sort of way, especially from more of a holistic point of view. But I wanted to do a little bit more of a deeper dive about our real why behind all of this. So like basically rediscovering or falling back in love with chiropractic in general. I had an accident essentially that ended up happening a couple of years ago. It was about 4 years ago. I used to be a professional rugby player for the city of Atlanta. And I had a pretty bad injury that ended up happening. I ended up making a tackle where I brought my head across the body. And as I made that tackle, I herniated and ruptured 3 cervical discs in my neck. So just to give you an idea, here's these lower discs down through here. Here's these lower portion of the neck down through here. And these little nerves that you see coming out of these right here, the disc ended up herniating and putting pressure onto the nerves right through there. So what it ended up causing a bunch of radiating pain into my chest and arm, which I had for about a year. So that was one of the main factors. The other factor that ended up adding into that, because this really ended my career, it was pretty big at the time, and I wasn't exactly eating the way that I should. So this was more of the metabolic part to this entire puzzle. I was pretty overweight by the end of my career. I ended up having a really, really bad injury. Between the two of those together, it ended up causing a lot of pain, a lot of health issues. I was declared a pre-diabetic. I had high blood pressure because of it. Because of all the symptoms, it basically mimicked the symptoms of a heart attack. And I ended up going to the emergency room a couple times just because I was so nervous about having a heart attack. Meanwhile, it was all musculoskeletal problems and other metabolic problems just in conjunction. So this is where I ended up going the medical route at first, even as a chiropractor. I ended up going the medical route. I saw an orthopedist. They said, all right, we did an MRI. We see all the damage, the injury through there. And we ended up going the route of getting a couple injections. And just like I see in my office all the time, we have injections done, people feel better maybe for a day, and then instantly it came right back. Because of how bad the damage was all through there, it didn't actually help. It really just masked it and took away some of the localized inflammation for a little bit, but then that was it. Immediately the pain came right back, I went right back to where I was, and instantly it felt like I wasn't able to get my life back. So I kind of dug back into my roots. I knew what the cause of the problem was, and I dug back into my roots and I started to look at it from a real holistic perspective. I started to look at it from a nutritional standpoint and from a musculoskeletal standpoint of like, I know how to fix this. I can end up fixing this problem. So I started with a pretty intense situation. It was a pretty intense fix. I knew that I needed to address the metabolic portion of this first to reduce all of my systemic inflammation. So I ended up doing a fast for about 3 days. It was just water, cayenne pepper, and lemon. And that's all that I had for 3 days. By the end of those 3 days, my pain in my arm and my chest was reduced by about 70, maybe 80%, to the point that I could actually start working on all of this and start getting it moving into the right direction. Now then, that's not really where the metabolic portion of it ended. Right after I ended up finishing the fast, I started a ketogenic diet because I really, after a little bit of research and whatnot, I saw how beneficial it would be to end up removing all the inflammatory factors involved with food from my diet. So I took out all the carbohydrates, went strictly keto-based diet for about the next 3 months. this was after the entire fast. And then during that time, I was about 80 pounds overweight. I was about 265 post all the rugby stuff. And I was just seeing patients and adjusting. I started to incorporate a little bit more physical activity again, so I started just running, and I started to get adjusted and massaged on a regular basis. So those were like the 4 main steps that I really took to getting control of this entire thing that I had been dealing with for about a year plus now. Okay? Once all of that was kind of in the works and moving forward, I was seeing a chiropractor weekly. I was getting trigger points, all released, which are basically little knots into the muscle from the disc and pressing onto the nerve root and causing those muscles to tighten up. And then the inflammation was just adding to all of that. So I was getting trigger points released by a massage therapist. My diet was like pristine for about 3 months, where I was super strict and mostly just ate meats, a couple of fats. I did eat some dairy, and then mostly root vegetables. So that was like those main things that were part of my diet, and then just the exercise. So I was doing little tiny like postural corrective exercises. I was doing scapular retraction exercises to try and pull in everything back, and I was trying to lose the weight, so that's why I was running pretty regularly. So that was my recipe for the fix. Okay, after every adjustment, I would feel a little bit better. We would end up getting some that's symptomatic relief for at least a little while we continue to work on everything. And the last 20% just slowly eased its way down over the course of about 3 months. So the really cool part about where we get to tie my entire story back in with this entire thing is now I see a lot of patients weekly. I do. I see probably between both of my offices, I see about 140 people a week. And I've incorporated this multifaceted healthcare strategy with all of them, and literally every single person that follows the plan and follows the way to correctness, all of them improve significantly. It's actually pretty remarkable to see the amount of improvement that these people are making on a day-to-day basis, as long as they are following all of the guidelines going forward. As a recap, my real reason to creating this channel is to be able to give you guys the information out there of what worked for me to get me from the point of disease and discomfort and bad health to a point of really getting my entire life back and being able to do all of the stuff that I love again. So I'm excited to show you guys what we are going to do going forward here with this channel. I'm excited to show you guys some actual adjustments going forward, and also some testimonials from some patients that's going to be coming up pretty soon. So I want you guys to remember to like, follow, subscribe, click the notification bell, and I will catch you guys in the next video.